Absolutely. The CDC has very clear guidelines on how to prescribe opioids. And it includes assuring, just like you all described, making sure that you've tried other avenues to treat that pain. For example, if it's back pain, have you tried nonsteroidals? Have you tried physical therapy or a TENS unit? Before you give a prescription for pain medication. The other thing that the CDC recommends is that the prescriber check the state database. So there's a prescription monitoring database in every state. The state of Illinois has one. And so in our organization, before a prescriber can write for an opioid prescription, that database has to be checked. It is a cumbersome step. It takes about 5 to 10 minutes. However, that database tells you if that particular person has received an opioid from another prescriber in another part of the state and picked it up. You know, it helps you identify people who are shopping for narcotics. And so it allows the prescriber to have a little bit more faith in that prescription. And so we follow those steps. The last thing that the CDC recommends is that the patient sign a pain contract where the nurse actually explains to them the risks and benefits of that opioid, the risk of addiction, and then asks the patient to agree to pill counts and random urine drug screens with a 24-hour notice. And all of our patients have to abide by those specific criteria or they will not receive an opioid prescription. When we implemented that process, it was about 2 years ago, we had over 300 patients in our patient panel who were receiving opioids for chronic pain. Now we have 38.
So it's obviously worked.
It's allowed us to reduce the number of prescriptions and transition patients who were previously receiving opioids to a more appropriate pain management protocol.